In Module 6, we are learning about rehabilitation and the role it plays in disability-inclusive health service provision. After completing this module, you will have an understanding of what rehabilitation is and the important role it plays in health services, have learned some simple steps to include rehabilitation within health services, and have increased your knowledge of local rehabilitation services. In this first presentation, we'll be discussing what rehabilitation is and why it is important. There is a growing need for rehabilitation as the population health needs change with increased ageing, increasing prevalence of non-communicable diseases, and the number of people living with the consequences of illness or injury. Let us consider who may benefit from access to rehabilitation services. While rehabilitation or therapy-related services may often be considered as being for people with permanent impairment or disability, rehabilitation is for all people with or at risk of functional impairment. This includes people of all ages and may be for short-term or long-term conditions that impact on function. Rehabilitation is defined by the WHO as a set of interventions that seeks to enable optimal functioning and minimise disability for those who have experienced an impairment as a consequence of a health condition or injury in interaction with their environments. Rehabilitation may involve working with an individual to improve their functioning, for example, walking or eating, and may also involve making changes or adaptations in their environment to facilitate functioning, independence, and participation. For example, installing a grab rail or chair in the shower to allow a person to shower themselves safely. Rehabilitation can also involve health promotion and prevention activities to provide early interventions that prevent and minimise the impact of disability, in addition to providing interventions where impairment has already occurred. Rehabilitation is an essential part of a comprehensive health service and forms an important part of the continuum of care for those with or at risk of impairment. Rehabilitation services broadly encompass three key areas: therapeutic interventions, advice and provision of assistive technology, and environmental modifications. The goal of therapeutic interventions is to improve, encourage, or develop functional independence. Therapy is concerned with restoring and compensating for the loss of function and preventing or slowing deterioration in functioning in any areas of a person's life. For example, mobility, communication, bathing, toileting, dressing, eating, learning, or working. For children with developmental delays or disabilities, therapy may be described as early intervention and aims to promote development in all areas such as movement, communication, cognition, social skills, and limit the impact of delays or impairments. Therapy measures include exercises and activities to address impairments and improve function, training and advice on modified compensatory strategies or different ways to carry out activities, education and support for families and carers, support and counselling, advice regarding environmental modifications, and support for the provision and use of assistive technology. Assistive technology includes items or equipment that are designed or adapted to assist a person with an impairment to perform a particular task safely and as independently as possible and improve participation in everyday activities. They are often prescribed by a rehabilitation worker. They may be used for people experiencing either temporary health conditions, for example, following surgery such as a hip replacement, or long-term or permanent health conditions, for example, spinal cord injury. There are many different types of assistive products to help people with a range of activities. These include mobility products to assist people to walk or move around, positioning products to support people lying, sitting, or standing in positions that enable everyday functional activity or prevent further impairment, daily living or self-care devices to assist with activities such as toileting, bathing, dressing, or eating, vision devices to reduce the impact of vision impairment, communication devices that provide an alternative means of communicating for people who have difficulty speaking or understanding speech, and hearing devices that assist people with hearing impairment to communicate and interact. Environmental modifications are changes in the home, school, community, or work environment that are necessary to improve the functional independence and safety of a person, usually with a long-term impairment or disability. Environmental modifications are many and varied and depend on the needs of the individual and their particular environment. These could include installing ramps in place of steps, fitting handrails to assist with going up and down steps or getting on and off a toilet, bathroom adaptations such as having a seat in the shower for someone who has poor balance or cannot stand safely or independently, adding tactile strips to guide people with vision impairment, raising the height of beds or chairs to enable easier transfers, changing door handles to make them easier to open or close. They may also involve thinking flexibly about where daily activities are carried out to optimise independence. Often, these modifications are made under the guidance of a rehabilitation specialist, such as an occupational therapist. Now that we have thought about what rehabilitation is, let us think about why it is an important part of the health system. If we consider good health to be a state of physical, mental, and social well-being, not just the absence of disease or illness, then rehabilitation plays a key role in good health by helping people to live, work, learn, and play to their greatest potential. As we have already learned, there is a growing need for rehabilitation as the world's population and health needs change, with ageing and increasing NCDs, and advances in healthcare meaning improved rates of survival following injury, illness, or neonatal complications, all of which may contribute to impairment. The availability of rehabilitation services is also part of achieving universal health coverage and is important to meeting the needs and rights of people with disability. Article 26 of the UN CRPD outlines the need for states parties to undertake effective and appropriate measures to enable persons with disabilities to attain and maintain maximum independence, full inclusion, and participation in all aspects of life. The benefits of rehabilitation are broad and may be at the individual, family, and community level. Some of the benefits of rehabilitation include reducing the impact of a range of health conditions by preventing loss of function, improving health and quality of life by increasing and restoring lost function, increasing independence in daily activities, increasing participation in family and community life, reducing caregiving demands on family members or support services, increasing ability to participate in key occupational roles, such as school or work, and reducing costs to the health system over the longer term. However, as we have learned in earlier modules, and when considering the ICF framework and the interaction between health conditions and a person's contextual factors, every situation is different, and therefore the needs and benefits of rehabilitation are extremely diverse, as we will see in some case studies on the next few slides and in cases in your workbook. Our first case is Ioane. Ioane is a 52-year-old man who has recently had his right leg amputated below the knee due to complications from diabetes. Following the amputation, Ioane was referred to rehabilitation services where he received a prosthetic leg and mobility aids, as well as training to teach him to walk using these assistive products, and modifications made to his home to ensure he was safe and independent in everyday activities. He received education and advice about how to care for his stump and prevent the development of secondary conditions. He also received training and practice in accessing the community, including the use of public transport. For Ioane, rehabilitation enabled him to regain his independence to move around his home and community, to complete self-care tasks for himself, and eventually to be able to return to his job. Our second case is of a young child with sensory impairments. Patti is a 4-year-old boy with vision and hearing impairments following a rubella outbreak in his community while his mother was pregnant. Patti was referred to early intervention services, which is what rehabilitation services for young children with developmental conditions resulting in impaired or delayed development are often referred to. Patti's parents received support and education to provide him with appropriate opportunities for play and stimulation to promote his development, and training on how to facilitate Patti's communication skills. Patti and his family also received mobility training to help him to learn to move around his home and community safely. As a result of these early intervention or rehabilitation services, Patti is able to play and interact with others, is attending kindergarten, and does activities like going to the playground, just like other children his age. We hope that this presentation has given you a good overview of what rehabilitation is, why it is an important aspect of health services and health systems, and the benefits of rehabilitation. Now return to your workbook and complete the activity in Step 3, where you will consider some more case studies and how they may benefit from Rehabilitation.